know generally my show focuses on the impact of mental health and wellness. And these are the mental health and wellness of people that are being affected in these crises. And I think it's always good for us, all of us collectively as a community, as a society, to be aware of those differences, the impact really that's happening around the world. It may not impact us specifically here in Canada, but it does impact a lot of folks. And we never know what could happen in the future. So we want to be very well aware of that. So Anushka, can you tell us a little bit more about some of your findings within that research?
Yeah, absolutely. So this research is ongoing. We are basically doing work in three different locations in the Swath Valley. And so we are currently starting our research in the second location, but I can share some of what has been emerging from the first field site. And what we are finding is that there have been big impacts on education rates. During the floods, many schools were destroyed, and even the ones that weren't destroyed, they were shut down. So you had a lot of young women, adolescent girls that actually withdrew from school. And what we know globally is that when adolescent girls withdraw from school, that it's very unlikely that they do then re-enroll. We've seen this in other humanitarian crises, such as what's happened in Syria. And that this often then leads to increased early marriage. And so we have been seeing similar patterns in Pakistan, where there are adolescent girls who have withdrawn from school and they haven't re-enrolled. And you're seeing this rise in early marriage. You're also seeing impacts on health just generally. So during the flood, during the evacuation, women had to just, whatever they could grab, they took it with them and then they left. So things such as contraceptives, they weren't able to take it with them. So, we had women come into our focus group discussions and share that they weren't able to take their contraceptives with them and they ended up becoming pregnant, and it was an unwanted pregnancy. And so you are seeing impacts on a variety of different health conditions and health outcomes. Another huge impact has been access to care has been hugely impacted. So in the Swath Valley, there were 40 bridges that used to go across the main river that goes through the center of the Swath Valley. And of those 40 bridges, there are only approximately 4 that are currently standing. So what that means is that how people are getting across this river is they're actually using pulley systems. So they're literally baskets and pulley systems that are getting people across this river. And of course, those aren't very secure. Even when I was there last June, there was an incident where the day before a woman and child fell into the river. And the river is so fast that once somebody's in that river, that's it. And so being able then to access care if you're a pregnant woman and you're trying to, get into some type of a health center to deliver, your ability to access that care is extremely limited.